Welcome to Aetna CVH Health Bill Pay, presented by Maryland Health Connection. Soon after submitting your enrollment application, you will receive a letter acknowledging receipt of your application for coverage. This letter outlines your monthly premium payment and instructions on how to pay your first bill. Within 7 to 10 days, you will also receive a bill in the mail to pay your first month's premium. It's important to note, your coverage will not be in effect until your first payment is made. Please be sure to pay your monthly bill by the first of each coverage month. The top of the bill will include your personal information. On the top right, you will see the date the bill was generated and your member number. The payment due date will be stated at the beginning of the bill. In the left column of the account summary chart, you will see previously made payments and any amount past due. The chart will then list the current premiums, adjustments, advanced premium tax credits, and any state premium assistance. This will total to your total amount due and any balance that will continue forward. In the right account summary column, the bill will recap the bill due date, the plan name, the member ID, the exchange ID, the invoice number, the invoice date, and the bill period. At the bottom of the bill, you will find the payment coupon. Include the slip when paying your bill by mail or in person. There are several ways to pay your bill. To pay by mail, send a check to the address on your monthly bill. Remember to include your payment coupon. To pay online, you can set up auto pay so you never miss a payment or make a one-time payment with your credit or debit card. You can make an online payment by going to aetnacvshealth.com/payment. To pay by phone, call Aetna at 1-844-365-7373 TTY 711 and press 1. Have your credit or debit card handy. After your first payment, you can pay in person by visiting any CVS pharmacy store location to pay with credit, debit, or cash up to $999. Be sure to bring the barcode payment coupon from your bill. It is important to note that CVS stores and Target locations are excluded. You cannot pay the first month's premium for a new health insurance plan in person. Now you are ready to pay your premium with Aetna CVH Health. Thank you for watching.